Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hand. It is the Haines Zancolli Test. Now I cannot find anything about the origin of this test, where it came from or where it was developed. It was referenced in a book in 1988, but like I said, I could not find the original, where this test came from. But what it does look like is that this test came about from a hand surgeon and researcher, someone who did a lot of stuff with hands, Dr. Eduardo Zancolli. And this test is a test to look at the oblique retinacular ligament in the finger. So it goes right along the side of here. I'll put a picture up right here that you can see what that does and what it looks like. And so this test is to look at either tightness in that ligament or is there a contracture going on in the finger. To perform this test, you can have the person's arm supported. Mateo said he's fine right here. And then what you want to do, you want to hold the PIP in extension. So we're going to hold that into extension right here. Then we're going to try to flex the DIP. If we are able to flex it, the test is a negative. But if, like Mateo here, we cannot flex it, that means it's a positive. However, we don't know, is it that oblique retinacular ligament or is it a tightness in the capsule? So that's when we go on to the second part of it. That's when we actually flex the PIP. Then we try to perform a flexion of the DIP. And if the DIP actually flexes in this position, that means that the oblique retinacular ligament is tight, so that first part of it is tight. But if it can't, that means that there is a contracture or a tightness in the capsule. So Mateo's back at the office, and I'm going to show you with a real live person here. So what we want to do, we keep that PIP in extension, and then as you see, we flex the DIP, and you see that's a normal response there. And if they were tight, we would flex there and perform it the same way. So we see that this is negative both ways. And getting into the research for this test, there's really nothing out there. I could not find anything on sensitivity, specificity, reliability, validity, nothing on it. So there's just nothing about the actual stats on this. But I will say, in any sort of paper or book, this test is referenced as an assessment method to have it in there when you're assessing somebody's hand. So a lot of hand researchers and specialists say, yes, you need to have this as part of your assessment. There was one article that did say that this is a test to utilize to determine if somebody should do conservative care versus a surgical intervention, because if this test is positive, their outcomes with the conservative care is possibly going to be pretty poor. So there you go. That is the Haines Zancolli test. What do you think about it? Do you use it? Do you know a hand specialist who utilizes it and maybe could tell us more about it? Let us know down in the comments. And like always, take care of yourself. Take care of your patients. We'll see you then.